Low back pain again is a very common problem. More often it is a lifestyle disease because more and more sedentary work, particularly people who sit and work in front of the computers, are increasingly prone for this disease. Now, there are discs between the vertebral bodies at the lumbar region. The lumbar spine is the most mobile part of the spine, so it undergoes degeneration, and whenever it is not maintained or misused, there is a possibility a disc can rupture or it can cause severe back pain. Now, the back pain again can remain in the back itself, or it can come down to either of the legs or to both the legs, and if the pain is not settling and the not responding to the treatment, and it has to be investigated. Now, the commonest causes of lumbar disc prolapse is the excessive strain on the system, which leads to a rupture of the disc, and the jelly like structure inside the disc comes out, causing compression of the nerve root, producing pain, numbness, weakness of the legs, difficulty in wearing the footwear, and difficulty in walking. If people are smoking and alcoholics, and some with high diabetes and metabolic diseases, can have predilection for this disc prolapse. So, it is essential that back has to be maintained by a proper posture and a proper exercise, so that we can prevent the lumbar disc prolapse. In case of disc prolapse, the myth that operation should not be done is wrong. If you don't operate, the nerve is going to get completely damaged, and once the nerve is damaged completely, it cannot be repaired, and even after surgery, if the total damage of nerve happens, it will not recover. So, it is essential that we diagnose this condition early, and when there is numbness or weakness, one must undergo surgery, and nowadays the surgery is very simple, minimally invasive. It can be done through a microscope or an endoscope to make the surgery very quickly, and the very minimal hospital stay. The goal of surgery is to minimize the damage to the nerve, relieve the pain, and improve the neurological function of the individual.